First time I was thinking, great, here I am in this terrible condition, I'm not so sure I'm not going to die, and they give me the intern. She was not an intern, but she looked like she could be an intern. My fear of my own condition led me to a far too quick judgment of her as a young OT, something I normally wouldn't do. My impression of her changed within 5 minutes of my first session. She had a way of showing me that she was in complete control and confident in her analyzing the limitations of my arms, legs, hands, and feet, and she gained my trust instantly. Plus, she was very positive, good-natured, and tried her best to learn all about me. She made every effort to get to know me as a person instead of somebody with a malady. Her manner was to treat the person as well as the illness, and it went a very long way with me. The fact that she took it upon herself to treat me as a person instead of her patient, even from the early going, is why we're still friends to this day. I came in contact with several different OTs during my time in the rehab hospital. Every OT had a different style, but the ones that I took to best were the ones I could tell were really invested in my recovery. These OTs paid attention to all the little details and realized the importance of my wanting to do things independently. Even though it had been a couple of weeks of me needing assistance for everything, they understood how much I hated having to ask for help. After all, I was a 33-year-old stubborn male. For example, Melissa realized that if we got my arms and my legs kind of propped up just a certain way in the bed, then I had enough strength to hold a toothbrush and I could brush my own teeth. It was something that I hadn't been able to do, and your teeth never really feel clean unless you do it yourself. So that was huge for me. You know, it's such a small thing, but it was just one less thing that I had to have help for. During my time in the rehab hospital, it was easy for me to tell the people who would empathize with my position. Being in the OT field, I imagine most of you have a great deal of empathy already. One thing that caught me by surprise is just how well they're able to put themselves in my shoes, physically and emotionally. My OT therapy sessions were as much psychology, which is my college major, as they were physical labor. Melissa was quick to assess what motivated me and catered her therapies around it. She also learned my personality and knew how hard she could push me. Like the toothbrush story I just shared, I was quick to verbalize how much I wanted to do things on my own. It felt unnatural to ask for help, and she was able to think outside the box, which is a phrase I hate. But it works in this scenario she made creative adaptations for me. In other words, she was treating the person, not just my GBS. The other great value I found in most of my OTs was how well they planned out my therapies. Having such limitations made for a very challenging training regimen for me. They were able to give me just the right challenge, knowing I could at least do the task a little. Even if I could not complete the whole task, just accomplishing part of it did a lot for my confidence and emotional state. Being able to even complete partial tasks helped me set a baseline from which I could build off of, and repeating those tasks later gave me something measurable that I could take from it so I could see how well I was improving. It helped me feel empowered after sessions instead of defeated. Now, getting somebody who can't walk, feed himself, or take care of himself to feel empowered is an art. The flip side of that is I also had a few sessions with different OTs that left the opposite side of the spectrum, left me on the opposite side of the spectrum, which was defeated. In a couple of instances, I felt the challenges were completely unrealistic, kind of a fit this square peg in a round hole scenario. The first was during the later part of my time there, I was working with a different OT, and I was able to kind of get myself dressed if I lay flat on my back and eliminated gravity. But this OT wanted nothing to do with that, even though I could not get my arms above my head. So she had me kind of sit down and slide my hands into the armholes, and then somehow I was going to be able to get this over my head. Well, I couldn't do this. So it was kind of me kind of ducking into the t-shirt. But then I ended up stuck. And I was struggling and wrestling with this t-shirt. It probably started out as a medium, and by the time I was done, it was a 2XL. But the problem that I really had with this was my mother was there in this session, as well as other patients their therapist, two good buddies of mine, and she left me in this t-shirt for 5 or 10 minutes. And I'm sweating just like a madman, and I'm exhausted. So I finally got this t-shirt on, and you'd think I'd be relieved that I got this on. But I was actually very sad. My mom was crying, my friends were irate, and I was humiliated and exhausted. So it was one of those moments that still kind of gets to me now, because you never want to see your mother cry. So it was kind of my opinion that she should have just ended that when she realized it wasn't working. And the other example that I'll share with you is I couldn't eat right-handed. This arm didn't work at all. But at that point, the left hand could, and I'm a righty. So it makes spaghetti kind of tough. So this OT decided that I was going to eat lunch with my right hand. And I told her, how is that even possible? Because I can't get my right hand up. She's like, oh, we're going to do it. And I was like, okay, great. So it was, I don't know, it was something with a fork. And she tried a couple of times, and she was very rah-rah, trying to get this arm to work. And it kind of broke me to the point that I'm not somebody that will ever snap at anybody. But I was kind of at a breaking point. And I said, just because you're cheerleading my arm doesn't mean it's going to work. I'd love for it to work, but I just want to eat my lunch. So that was another example of kind of being realistic in how therapies are done. This OT didn't have the same bedside manner as the one I was used to, but I can't say her methods didn't work. She was more of a kind of a tough love OT, but my psyche was already very fragile, and I was away from my family, and I just didn't feel like it was as therapeutic as some of the others. So I haven't mentioned this yet, but I'm also the proud son of an occupational therapist. It's a little ironic. My mother, Maggie, has worked in the OT field somewhere close to 30 years. Her specialty was early intervention, birthday age 3. As you can imagine, the fact might have been intimidating as an OT treating me as she sat there next to me. But then again, you don't know my mom. She's one of the most passionate and caring people that